Madam Speaker, my questions to the Minister of Health. Experts in healthcare policy know that people should be attached to primary care in their local community. Other jurisdictions have taken the bold move to set clear goals of when people will be attached to their primary care provider and post them publicly. In Nova Scotia, there's no publicly disclosed plan about how or where attachment to the Family Practice Registry works. Will the minister explain to the legislature exactly how Nova Scotians are being attached to primary care in Nova Scotia?
I recognize the Honourable Minister of Health and Wellness.
Thank you. Thank you, Madam Speaker. So certainly there's a number of ways in which people are being attached to primary health care. So first of all, whenever we have the opportunity, we work with retiring primary care providers like physicians and nurse practitioners so that we have opportunities to transition these folks out and new people in. And so sometimes we stabilize a practice, which keeps people attached. Other times we're able to add net new primary care providers to communities, and so those individuals are then, of course, assigned from the Native Family Practice Registry, and those clinics are improved over time, or those folks are brought on board. And then thirdly, I would say we're also looking at existing clinics and looking at ways in which we can add a number of members to those teams and in order to attach more people to existing clinics.
I recognize the Honourable Member for Halifax-Armdale.
Madam Speaker, thank you. There are more than 95,000 Nova Scotians on the wait list for attachment to primary care who have no idea when they will see a family doctor. Many Nova Scotians call the registry to provide updates and changes in their health, some serious, but there seems to be no system for attachment based on patients' needs. Some people are waiting 5 years for their attached, others are waiting 5 months with similar medical issues. In both cases, they're often neighbours asking, how does this work? Without clear public data, Nova Scotians are left wondering when they can expect to find a family doctor. Will the minister explain why there appears to be no predictability for people on the wait list?
Before I recognize the Honourable Minister, I've just been informed that members seem to think that they can turn their back and use their phone during question. I would suggest that no one uses their phone. It is not allowed. If it is to be caught, they will not be recognized for the rest of the day. There's certain rules in here that you have to live by. So, once again, stay off your phone. I recognize the Honourable Minister of Health and Wellness.
Thank you, Madam Speaker, and I certainly want to acknowledge the individuals who are attaching people to primary care. They're working very hard. When we formed government, that list was simply a list. We had no line of sight on who was on that list, where they were, what their information was, any of that. We have used technology, and we're working very hard to validate the people on that list to make sure that it's now a tool so that we can look at ways in which people can be attached. We can get that information updated through 811. There's people working very hard around the validation process, and it is tedious and it is slow, but that work is imperative. And what the member opposite will know is that as a result, there has been thousands and thousands of people removed from that list, and for the first time in 2 years, that list is at 95%.